This one right here is the cornea. This one is the pupil. The one that is affected is the pupil. Either you say the pupil or you say the lens. We see through the lens. The lens is a normal mirror in the eye that we use to see. So when the lens changes to white, cataract is the change of the normal lens which we use to see. Everyone has normal lens. Even the animals has normal lens. All living creatures that has the ability to see have normal lens. And based on trauma, and it can be congenital again. So let's go through the introduction. I need a volunteer, please, to read for me the introduction. Cataract can only be cured through surgical intervention. That white patches in the eye, it cannot be removed in any other way except through surgical intervention. So please, we have to take this information to our community. We have to change their mindset that they should not use any native herbs on the eye. The only solution for cataract is surgery. Okay? It can be mature and immature cataract. When it matures, that is when the cataract is fit to be removed or to be operated on. When it is immature, you cannot detect it at the early stage. You can only detect cataract when the person complains of blurry vision. The person will tell you, I'm not seeing from a distance. I cannot read. That is why we normally use this visual acuity. If you have been at any eye clinic, you notice that we have this one. This is the baseline intervention when someone comes to our clinic. We use this one to check. And we normally check this visual acuity within 6 meters. When the person sees from 6 meters to here, we write it 6/60. If the person can see as far as here, 618, but cannot see here, or 624, or 636, or even 660, based on the examination, which we use a slit lamp or this ophthalmoscope. So the causes and risk factors of cataract. Most cataracts are caused by a natural aging process, often appearing around age 40 or 50, with symptoms typically becoming significant after age 60. Okay? So whenever, we all are humans, whenever we are above 40 to 50 years, we are at the predisposing factors of cataract. Cataract can affect that person. It can show up because we already have lens. It just depends at what age your own lens change. It can change at young age. Some people may be fortunate. It cannot change until they get old. But it is normal with the aged people. Some people will come to your clinic, they will not have the patient to read. Like someone who is an office worker. You know, the person is going to read every day, or the person is going to type every day, but the person has refractive error. The refractive error comes based on the cataract. The person cannot see, the person cannot read. So the best you can do for the person is to refer the person to the refractive unit, which they can order glasses, lens for the person. The person will be using glasses until the cataract is matured. Do you guys understand that one? Yes, ma'am. So based on the review, there are another objects here. But you cannot see except you use light. Except you use light. I please want to demonstrate something. Let me use your phone light, please. Okay. So please help me. Come on. Please. So you see within this eye, you see the cornea there. Within the cornea, you have the cornea. You see it? Inside here. Please. Come up here. This black part is the cornea. Within the cornea, that is the pupil. So whenever you cannot see it, but as you saw it, eh? Yes. So where are we? Agent. Okay, I was explaining about the protein, eh? You give to the patient before the surgery, eh? So when and where this pre-operative care starts? The pre-operative care starts when the patient comes to your facility. When the patient comes to your facility, that is when the pre-operative care starts. So for you now as a nurse working in a ward, your own pre-operative care for that patient starts immediately when the person comes to your own facility, to your own ward. So the first thing you need to do is to revisit the patient's biodata. Okay, because the patient will be coming along with his or her chart. Okay, as a nurse, what do we do? You have to verify, you look at it.
So I need to say thank you. The teaching was nice, it was well explained, the class was in order, and the negative side, the things that I want you to be improving on, the teaching skills, and the communication skill also. And then you have to be slow down your teaching.
Thank you. Faster, yeah? All right, thank you. Thank you. One more person, please. One more person, please. So, do you have a feedback sheet? At least want you to add it here. Okay. So I can reflect on it. So, one more person, please. If not, thank you all guys for your audience, okay?